Hi, I'm Natalie Metcalf, and right now I'm going to be checking Jasmine's thorax and lungs. I'll first do that by inspecting um, her chest wall, rib cage. It should be in an elliptical shape. Um, her ribs should be sloping a little downward, um, usually at a 45-degree angle from her spine. We're checking her color, which is pink. She's dry. Her respirations are easy and unlabored. Also, we'll be checking her position. She's relaxed. She's alert. She's cooperative with us, and resting pretty easy. Next, we want to palpate. We want to check for symmetrical expansion. So what we do is we can put our hands posterior laterally down by T9, T10 with our thumbs a little bit apart, pinching a little skin, and then we can ask the patient to take a deep breath and hold it. So take a deep breath, Jasmine. Good, and relax. Good. And her rib cage, it moves equally bilaterally. Probably about, thumbs move about 1.5 to 2 inches apart, so that's good, that's normal. Next thing we're going to do is we're going to check for tactile firmitus, and the way we do that is you use the ball of your fingers up here, and we're going to have the patient repeat 99, just checking for normal vibrations without the lung fields, and working side to side and all the way down. So go ahead and say 99.
99.
Good. And again.
99.
Good. Again.
99.
Again.
99.
And again.
99.
Again.
99.
And a couple more times.
99. 99.
Good. And normal vibrations. So Jasmine has normal tactile firmitus. So next thing is we're just going to palpate, and we kind of did that as we were checking the tactile firmitus and palpating for any lumps, masses, tenderness, anything like that upon palpation. Now we don't feel any, so that's good. Are you having any tenderness anywhere, Jasmine? Okay. Next thing we're going to do is we're going to percuss over all of her lung fields, side to side, bilaterally, and all the way down. So the way we do that is we're just going to have the patient sit up straight and relax, and we're just going to listen for any resonance, which could mean an emphysema, anything like that. And we want a little bit of resonance. That's normal. Should be a little low-pitched, clear, hollow. So, good. I didn't feel anything dull, which could mean tumors, masses, fluid consolidation, anything like that. Everything sounded within normal bilaterally. Next thing we want to do is estimate diaphragmatic excursion. How we do that is we have the patient inhale real deep and hold it. Go ahead and inhale real deep and hold it. We're going to check for where it's dull. Okay, Jasmine, that's good. We'll take a pen or some way to mark it. So we'll mark that area to where we run into the dull, and no resonance. So that's marked. So go ahead and exhale, Jasmine, and hold it. Okay, so until we feel the dull area again, and we'll mark that area. And you can see over here that the 2 marks, it's probably about 2.5, 3 centimeters excursion, which is within normal limits for Jasmine's small frame. So, and you can do that, and you can check it again on the other side, and you want to make sure those two sides are fairly equal bilaterally, that she's got the same excursion on both sides. Next thing we're going to do is we're going to auscultate. So we're going to listen to her lungs in all fields on both sides. Make sure they're even. Jasmine, go ahead and take a deep breath for me. And out. And again. Okay. Again. Again. Okay. Again. Okay. Again. 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 Okay, again. Real big. All right, and again. Okay. Jasmine's lungs are equal bilaterally. No adventitious sounds heard posteriorly. For the sake of privacy, she is wearing a sports bra and is not completely undressed. But for a patient, you would have complete skin exposed in a gown to not be able to hear any sounds or anything rubbing against your cord or the diaphragm, such as clothing. So, that sounds good, Jasmine. Next, we want to perform bronchophoning, and how we do that is if there's any, if you think you hear any adventitious sounds or anything like that, we can go back and place a diaphragm on, that part of the lung or area, and we'll have the person, we'll say 99. If you can hear it clearly, that's actually abnormal. So if it sounds kind of whispered or fuzzy, then that's normal. Okay, so we'll have her do that. Okay, Jasmine, I'm going to have you say 99.
99.
Okay, good. And that was not very clear. It was pretty muffled, so that's normal. That's a normal finding. Next thing we'll do is we'll perform a whispered pictoriloquy, and how we do that is I will listen to the area again, and I will have her whisper 1, 2, 3, and that you also do not want to be able to hear that clearly. You want it to sound muffled also, and if it does sound muffled, then that's a normal finding. So, once again, go ahead and whisper 1, 2, 3, Jess. 1, 2, 3. And no, I barely heard that, so that is normal. Next thing we're going to listen for is something called egophony, and we can listen in that area, and we'll have the patient say E, E, E. And we want to hear E, E, E. If we hear more of a ah when she says that, then that's abnormal. So we'll check for that too. Okay. So now I want you to say E, E, E.
E, E, E.
And that's also normal. So that is it for thorax and lungs. Everything's normal.